welcome to the Centre Think Tank interview series In Conversation. My name is Torrin Wilkins, the Director of Centre Think Tank, and today we'll be discussing social care, artificial intelligence, NHS funding and prevention within health. With me today to explore these issues further, I'm delighted to be joined by Allison Gardner. Allison has a wide range of experience, including as the Member of Parliament for Stoke-on-Trent since 2024, as a scientific advisor for the National Institute for Health and Care Excellence, or NICE, on artificial intelligence, and as a lecturer at Keele University, where she taught data science. She has first-hand experience of the issues we'll be unpacking today with her work on artificial intelligence and its applications to healthcare. So thank you so much for being with me today, Alison.
My pleasure.
So for my first question, the government, of course, has announced an independent commission to reform our social care system, alongside some more immediate investment. The issues at the moment include high prices and lack of availability. So how do we reform social care to make the system accessible for anyone who needs it? And why is this particular review needed when we have so much work previously on the topic?
I'll take the second part of your question first, which is why do we need this review? Now, in the previous government, and I know I don't want to sort of go hark back because people get fed up about it, but we do have to deal with the realities of what we're what the existing situation. So in the previous government, we had 10 ministers for looking at for social care in that time since 2010. So you get this disjointed, loads of innovation, loads of reviews, and it just starts to fall apart quite a lot, and so it's a very unstable system. And so what this review is doing, the Casey review, it's taken a short-term view and a long-term view, which is quite good. So next year they want to sort of look at what actions need to be taken now to really fix some of the fundamental problems that can't wait, and then taking the longer term action of 2028, they'll have a sort of set of actions and recommendations coming out at that point to see how we can reform it. And the key part of this is to bring in stability, to make it a cross-party consensus. So no matter who is your Minister of Social Care, no matter who is your government, that we start building that coherent National Care Service, which I know we've talked about in our manifesto, so that it lasts beyond a single government, to be truthful. And the reason why it's so important, when everybody says we want to fix the NHS, and I spoke to an excellent chief exec of one of my local trusts who is since retired, and I said, what do I need to do to help you, run your hospital efficiently and help the NHS? And she said, fix social care. You can't fix the NHS without fixing social care. So this is the aim that we're doing. So, and the other problem that we've had is that social care is delivered by local government. And we know that all of our local councils have had cuts on their knees, just trying to float above bankruptcy. Most of them, some of them have gone bankrupt, and that is just an unmanageable situation. So particularly with mine in Stoke-on-Trent, that we're trying to do, I have a number of councils in my constituency, but using Stoke-on-Trent as an example, the adult social care budget and the children in care budget is really, really high, and we need to be able to deliver that and prevent that from happening. And so we need to invest in our local government. So they are putting 1.3 billion into local government and ring fencing about 600 million, just to look at social care, to try and do that. Sounds a lot, but actually across the country, even that isn't a big amount, but it is quite an urgent situation. So we do need this review, because we don't want reform that is done for, good news bites, headlines and stuff, but actually isn't meaningful. This is the deeper, cutting edge type reform that we need, so that will last.
So another question, I suppose, around social care is kind of about its future. And as you say, at the moment, there's this real struggle even to deliver sort of the basic provisions of social care. And of course, one that's been floated is the idea of making it free at the point of use, just like many other national health services. And so would that be affordable? And is it something the government should consider? And sort of what time frame do you think that's on? Again, we spoke about sort of the challenges here and now.
Here's a good question that I joked earlier about. Don't you get me making any funding commitments and spending commitments off the. Do you know what? That we'd have to wait for the outcome of the review for that one. I think in the best will in the world. I mean, a lot of social care is free at the point of use, but it's a very, very complex system, and there with a wide range of needs from a wide range of people. So to sort of say anything sort of large scale like that would be quite challenging. So I think we do need to depend on the case review to see what suggestions are there as to what funding models. I suspect it might be a mixed funding model. I mean, who delivers what, I think is a key question. We are looking to do things such as, we might touch on them later on, which is the neighbourhood care service, as well as national care service, and how that would all work. So at this moment I wouldn't say, and I think the thing is that we should be able to provide support for the people who need it when they need it, and then to be the right type of support. And whatever funding model that you have, it has to be done that is affordable for the services that are delivering it, but also for the people receiving those services.
And thinking about the review itself, so is there anything that you're hoping that it sort of comes out with that's new compared to older reviews? Because I always find this a really interesting one, that it's very much that there have been quite a number of reviews now that have been sort of taken place on this issue. So is there anything that you think it could shed light on that hasn't been covered before?
I can't give specific examples, but I think it always works. It's always really important that we don't reinvent the wheel. So we need to see what works or what has worked in the past, and think, well, let's not reinvent that. Let's not even rename it because we want it to badge it as ours. If that works, let's build on that and what hasn't worked and why it hasn't worked, and go right. So we either scrap it or we learn from where we're doing. So I really don't want where we just wipe everything fresh and start again. So we have to have that view, and a sort of a classic example would be the impact that Sure Start centres had. Now this seems to be very early, it's for early children, but the long-term impact on people's life opportunities, both in terms of what they can do with their lives, but within their health and within their education, is massive. And so I would hope that because they're taking this little bit of time to develop it, that we do take that longer term strategy of what can we fix it now. We might not see the benefits of that until 15, 20 years time when the people are adults, but that can be fixed. So that's what I would like to do. And the other thing I would really, really like is that this is not something that is developed in an office in London, that this is done in collaboration with the people who matter, which is the people, and the people who need those services, and that they don't have reforms done to them and what we think is good for them. It's that they tell us what they think would help them and what would be good for them and what would be good for their communities, and we listen about that. So maybe there has to be some sort of flexibility in there for local delivery.
Now, technology and specifically artificial intelligence has been spoken about a lot recently, and it's often proposed as a solution for many of the serious issues that the NHS faces. So is this as much of a game changer as often described, or will this need to be alongside some more wide-scale reforms?
Has to be under some wide-scale reforms. The key thing is technology is not a cure-all for really basic systemic problems, and sometimes technology isn't the answer anyway. Some of it's lower tech or non-tech solutions actually will do a lot more in delivery and making sure that there's future resilience and improvements within the service. So I'll separate the two questions out. There does need to be reform in how we structure things. It's because I worked within the NHS, and I was an NHS campaigner when I was a councillor, and I struggle to work out what is where, and it's an ICB and an ICS and PCNs, and then NHS England, and then within NHS England, 1 minute we had NHSX and NHS Digital, and now we've got NHS Transformation and stuff like that. And I was just like, stop! stop, and it was just crazy. And I'm not going to bang on, but I could go on. So one big reform, very brave, the scrapping NHS England. That's very radical, very well reasoned, but often it's how you now enact that over this 2-year period and how you shift in-house into the DHSC the functions that need to remain central, and then move out into our local areas so that we get that front line delivery that we want and that people want. And I will just say that doesn't necessarily mean we have less managers. It's where those managers are located. We do need NHS managers to deliver these services. So I hate a little bit about that rhetoric of not having NHS managers. We just need them in the local, delivery of services. So that is one aspect. So I welcome those sort of reforms. With regards to technology, there are areas where we can have significant improvements. So we are very low on scanners, and very, and the ones that we do have are aging. So, I welcome the 3.1 billion, I think it is, to give over to scanners in the capital budget that we do to try and improve that early diagnosis. But there has to be within everything, and this is my specialism, when you're integrating technology into the delivery of health services, that you have to have the correct governance processes, because technology is very positive, it's very good, but you've got to deploy it in the correct way and manage it in the correct way so that you get the resilience and you don't get the harms of when it goes wrong. So that would be my one caveat.
And in terms of NHS England, of course, big news that it's being abolished. Are there any cautionary sort of tales there as to what the government should and shouldn't do with those sort of extra powers and personnel? I know you said about managers and sort of integrating them into the community rather than where they are. So how would you like to see that sort of transformation?
Oh, that's a tough one. That is a really interesting one. I think there's a clear separation of what is, what is required central. So, I mean, one of the big bugbears is procurement into the NHS. So the decisions made as to what can be a local decision, and then what can be procurement that is across the NHS and can be implemented throughout. So what you do get, and this is now my personal opinion, so I'm not speaking for the government, when you have the local delivery, you have all these technology systems, and they might not necessarily be interoperable with, another region systems, or, and if you're hopping between specialist centres and stuff like that interoperability and that, sending of your information and your notes is quite challenging. And then you just get this complexity in the system. So, the role for the government has some say in that one. Classic example, local NHS institutions are very risk averse. So in one, to do your DPIA, your data privacy impact assessment, to try and get a new technology in one, for the same technology, it can take a week for that approval to go through. In another one, it can take longer than a year. And this hampers this innovation going into the NHS. So what the central localised government could do is to try and implement some frameworks that all parts of the NHS adhere to try and streamline that, and we don't get that variability. And the same with the statutory requirements. I'd like to see that, to make sure that things are governed correctly post-deployment, and it's not about getting those innovation into the NHS, but it's well governed, but not just with technology but with other systems. So I can see some central use there. But locally, I would also like people to have the flexibility to deliver the services they know they need for their local areas. So some rigidity from central government on key things that can be cross, that NHS throughout and social care throughout, but some flexibility as well to deliver what local people know they need.
Now, the NHS is often seen as a bit of a national institution, and it's, of course, free at the point of use. But there are also conversations around the funding model for the health service, in particular from the Reform Party at the moment. So do we need to change the funding model for the NHS, or is this more about how much money the NHS has and where it's spent?
Right. So Thank you for mentioning this. And yes, there are people, and not just Reform, but the Conservative Party have also done it. With, and there's a book with Jeremy Hunt, who was a previous health and social care minister, looking at privatising the NHS. I do worry sometimes that this free at the point of care sometimes is a cover up, but it actually, what matters is what it feels like to the people receiving the care, and it's free to them. That's fine. So no, it absolutely 100% should not be going down the Reform and the Conservative model. And we've seen this with the deliberate managed decline of the NHS to be able to then start instituting that change in the funding model. It needs to stay as it was. It can work. It just needs to have that proper belief in it. There's the reform that it is needed so that it does work properly, that the focus on things like preventative health will be managed, and we need to get the nation well. So I think we fight tooth and nail to protect our NHS. It is ours. It is, it should be publicly owned. It should be accountable to us. It's the people's NHS, and I do not approve of any changes to the funding model other than to improve what it already is.
So for my final question, of course, the discussions around treatment are incredibly important, but so is preventing illnesses. And I think governments for a long time have known that this is incredibly useful and also saves quite a lot of money when we detect illnesses early. It's good for patients and it's good for public finances. So how can we actually do this more effectively now?
Okay, again, it's the longer term view, and I think it might have been Wes who says this, and then we should think of it less of a national health service, but a national wellness service in many ways, and so an example would be dental care and getting children to brush their teeth. Now we know that there is a real issue with children's dental care, and actually one of the top reasons for children being taken into hospital is because of tooth decay and issues with their teeth. So that is one issue, but that type of health doesn't just fit with the mouth. Oral hygiene and oral dental health actually impacts your entire body. So if you have various types of gum disease and stuff like that, there's loads of triggers that can have long-term health issues. So oral health is actually really vital for long-term health. So it's not a sort of, we want everybody to have nice smiles and we don't want children going into hospital because they've got rotten teeth. It's about their much deeper health thing. So some of these initiatives are really important, and there's a lot of science behind them for the longer-term health benefits. So that is a good example of it. Giving people more control over their health as well, and stopping this fight to get yourself heard sometimes. So using the NHS app where all your health records are there and it's all shared between it, and you can develop that, and that transparency as well. I quite like, you can see what the doctor's writing about you, so they can't be as dismissive necessarily of your health concerns that can happen, especially if you're a woman. So that is really good. But I think we need to look at education. But I referred back to the beginning of the interview about these longer term approaches that we have, and I'm really keen on the idea of this neighbourhood care system, a neighbourhood health service that they're talking about, where it's within our neighbourhoods, because there's so much that we have in our communities that are doing so much positive. So I was a charity that I did some I visited was called Walk Talk Action. And Walk Talk Action, and there's other charities are available, but this is in Stoke-on-Trent. And they just do the very simple, just walking, just going for a walk, very low key, just walking out in parks, but it gets people physically active. Physical activity helps. They gets them out of the house, so that loneliness there gets them talking, so they start getting used to chatting to people, so it helps with the mental health and loneliness. And then from that very simple activity, the other services can come in and help and link up, and that communication happens. So these neighbourhood health services and that can happen will have that wraparound care. And so often these complex problems that will start with one and then you just end up spiralling can actually be preempted. And I just would love a future where we just realise we have an ageing population as well. And I spoke to a very large housing developer not that long ago, and I said, okay, you've got 250 odd houses here, you haven't got one bungalow. This is interesting. We have an aging population. How are you doing that? Now, they were designing into it that everything was wheelchair friendly and that idea of that accessible living. But I think we need to have real conversations about the lifelong needs that people have and build it within in all of our systems. So if we're building 1.5 million houses, we need to think about what those houses are and how we can have that assisted living going on. So it's quite exciting. But again, going on to preventative healthcare, trying to catch illnesses and treat them before they get serious is really key. And so this is diagnostics, but I would also say just better access to the GPs better supported so they have time to listen to patients, not 10 minutes where you can talk about one issue, but actually what you do is you've got a complex range of issues that are all interlinked, and it allows that deeper conversation. So one thing I really welcome is this, the promise that we're going to have our named family doctor again, and we don't see a different GP every time, and you have to start explaining yourself every time because it's tiring. Now, I'm not, yes, I say, not from personal experience. Yeah, it's true.
Well, thank you so much for joining me today and discussing everything from health, artificial intelligence, and social care. And it's been really great to speak to you as well.
Oh, it's been lovely to speak to you too. Thank you.